Good evening. My name is Carl Van Amberg, and I'm a physical education major here at SUNY Brockport.
Hi, I'm Kyle Bree. I'm an exercise physiology major.
Hi, I'm Kristen Lafort. I'm a kinesiology major.
Are we recording?
We're live.
Good evening, Brockport. As always, I'm Kyle Bree with my co-host, Carl Van Amberg. Tonight on our newscast, we'll take a look into the genetic and extrinsic factors that influence both normal and abnormal fetal growth and prenatal development.
Do you ever wonder what happened in those 9 months before birth? Why some children have abnormalities, why some don't? What causes these, and are they preventable?
Tonight we'll take a look into these questions.
The growth process begins the instant an ovum and sperm fuse in fertilization. Genetics will determine the normal aspect of development, and intrinsic factors will affect the very sensitive growing embryo inside the uterus.
Congenital anomalies, or birth defects, are the single most common cause of infant mortality in North America. And these birth defects are not always noticeable at birth. At age 2, 6% of children are diagnosed with birth defects, and by the age of 5, this number increases to 8. Genetic anomalies are the most common cause of birth defects, accounting for an estimated third of all cases. One of these causes being mutations, a change in the DNA structure, where there is an error in the DNA replication during the cell cycle or an influence on the environmental agents such as chemicals, viruses, or radiation.
The most common anomaly is trisomy 21, better known as Down syndrome, an event where the 21st pair of chromosomes has an extra chromosome. Those who suffer from Down syndrome tend to have outgoing and affectionate personalities, but also show signs of mental retardation, distinctive facial features, visual and hearing impairments, as well as heart defects.
Down syndrome occurs in about 1 out of every 700 to 800 live births in the United States. This number increases with the proportion to the age of the mother.
For women under the age of 30, the chances are 1 in 3,000. By age 35, the risk increases to 1 in 365, and by age 48, the risk jumps to an astonishing 1 in 9.
About 75% of victims suffering from Down syndrome died before birth. About 20% died before they reached the age of 10.
For those who do survive beyond 10 years, life expectancy is about 60. And after 40, many develop early onset Alzheimer's disease, linked to a gene on chromosome 21.
Substances that cause anatomical deformities and malformations are known as teratogens. These fall under 3 major classes of drugs and other chemicals: radiation and infectious diseases. The effect of a teratogen depends on the genetic susceptibility of the embryo, the dosage of the teratogen, and the time of the exposure. Exposure during the first two weeks usually does not cause any birth defects, but can cause spontaneous abortion. The greatest time of vulnerability is between weeks 3 through 8. Different organs also have different critical periods. For example, limb abnormalities are most likely to result from teratogen exposure during 24 to 36 days, and brain abnormalities between weeks 3 to 16. Sedatives, barbiturates, and opiates should be avoided during pregnancy, and even some acne medicines, such as Accutane, have caused severe birth defects. Many teratogens produce less obvious or delayed effects, including physical or mental retardation, inattention, strokes, seizures, respiratory arrest, crib death, and even cancer.
That was quite the lesson, Kyle.
Yeah, that was quite the
informational session. Anyways, alcohol causes more birth defects than any other teratogen, and even one drink can have adverse effects on fetal and childhood development. Fetal alcohol syndrome, which is characterized by a small head, malformed facial features, cardiac and central nervous system defects, and stunted growth. Behavioral symptoms include hyperactivity, nervousness, and poor attention.
These are interesting facts, Carl.
Cigarette smoking also contributes to fetal infant mortality, ectopic pregnancy, anencephaly, cleft lip and palate, and cardiac abnormalities.
Don't judge me.
So what should you do to keep your child healthy during prenatal development?
Well, I'll tell you, Kyle. Research shows that a well-balanced diet along with proper and moderate exercise can help support prenatal development. Consult an obstetrician as soon as you think you're pregnant and follow guidelines that they give you, and make sure you follow these specifically. Also be aware to avoid teratogens such as alcohol, cigarette smoke, radiation, and any other harmful chemicals to help ensure proper prenatal development.
That's good, that's good. Thanks to know, Carl.
That's all the time we have for tonight, Brockport. This is Carl Van Amberg saying goodnight, along with my co-host, Kyle Bree.